everyone. Welcome to the webinar. We're going to get started now. So just a few housekeeping items. All of the attendees' phones will be on mute. If you do have a question, you can either use the raise your hand function or you can type your question in the question box. We'll be taking questions at the end of the presentation. And then I'm going to hand it over to our moderator, Christy Truesdale. Christy has been with the Children Environmental Health Network since 2011, where she provides program and operational management and leads marketing, communications, and fundraising efforts. Christy?
Hi, can you hear me?
Yep.
Thanks, Megan. I'm just trying to advance the slide. There we go. So thank you. Thanks, Megan. And good afternoon, everyone. Good morning for those of you out west. Thank you so much for joining us today. I'm very pleased to serve as the moderator for this webinar, which highlights some very exciting work that we've accomplished with our partners to advance best practices in early learning and child care settings. So we'll start off with a brief overview of the Children's Environmental Health Network, otherwise known as CEHN. We are a national multidisciplinary nonprofit with the mission to protect the developing child from environmental hazards and promote a healthy environment. And we work to achieve this mission by promoting preventive research and advocating for sound protective policies that have been informed by that research, raising awareness of children's environmental health issues, and educating and training various audiences about children's environmental health and about simple and cost-effective ways to reduce children's exposures to toxic chemicals. We are a science-based organization, and we've been around now for over 24 years. 2017 is actually our 25th anniversary, so a really big year for us. We are pleased to have been around this long, doing a lot of work to protect children from environmental hazards. The work you will hear about today was funded by the Centers for Disease Control and Prevention as part of their Health in All Policies portfolio. Health in All Policies is a collaborative approach that integrates and articulates health considerations into policymaking across sectors to improve the health of all communities and people. Health in All Policies recognizes that health is created by a multitude of factors beyond healthcare, and in many cases beyond the scope of traditional public health activities. So this is the fifth and final year of CEHN's 5-year cooperative agreement with CDC. And over the past 3 years of this agreement, we have provided technical assistance and capacity building to advance these best practices in environmental health in child care settings. So our presenters today will be addressing why they worked with us on their specific project, some of the lessons they learned, and some new developments and exciting resources that are coming out of this very fruitful partnership. We have 3 excellent presenters. Oops, I went ahead. Is there a way to go back? Thank you. So we have 3 excellent presenters today who I am going to introduce each of them before their respective presentations. The first speaker, Hester Paul, will be speaking about children's environmental health in general, sort of an overview. You know, what do we mean when we say children's environmental health? Then we are going to hear from Susan Hedges, who will be sharing about about the exciting work that we've done with the National Association for the Education of Young Children, henceforth abbreviated as NAEYC, N-A-E-Y-C. And last, we will share what we learned from exploratory investigations on child care policies performed with the Environmental Law Institute. That will be shared by Toby Bernstein. And then after this, we will have a question and answer period for all presenters. I am going to ask that you please save your questions on any given presentation until our final presenter has presented. So without further ado, our first presenter is Hester Paul with the Children's Environmental Health Network. She has been the National Director for the Eco Healthy Childcare Program since 2008. Hester is responsible for expanding the program so that children throughout the nation benefit from the reduction of harmful environmental toxins in child care facilities.
Can you hear me, Christy?
Yes.
Okay, great. Sorry, let me get my slide going here. Great. So again, I'd just like to provide you guys with a little bit of an overview of children's environmental health and why we want to take into consideration the differences between children and adults. So why are we focusing on children specifically, not just within this project period, but then also within the organization of Children's Environmental Health Network? We know from just a plethora of research that children are not just little adults. We know they're very different from adults, first of all, in what they consume. So they actually, pound for pound, or body ratio to body ratio, they're eating more food, they're drinking more water, and they're breathing more air than adults. Just looking at the breathing of air, they have smaller lungs, and so they breathe more rapidly, meaning they're taking in more of the surrounding air than an adult would in a given setting. We also think about food variability. They're not eating as many different types of food as children are, and so thus you have to be careful about what they're eating. For example, it's smart to serve, ideally, breast milk or organic milk when you're looking at a child, because you want to make sure you're always trying to reduce the amount of toxic chemicals, growth hormones that are being consumed by the child. We also know they have different behaviors than adults. So you don't typically see an adult sitting on the ground very often, or crawling on the ground, rolling on the ground, but that's where the children spend their time. So we have to be thoughtful about what dust is present, what dirt is present. Are they sitting on carpet? If any of you guys have ever lifted up old carpet before, you know that no matter how much you're vacuuming or cleaning, you can pull it up and there's a ton of mold and mildew and dust and dirt. And so all of those particles are being inhaled when they're sitting down on carpet. That's just one example. The next thing is that we know that they're in that extreme phase of development. So 0 to 6 is what we focus on within this program, but we know that everything we're talking about is very much applicable to older children as well as adults when we're talking about protecting people's environmental health. But we know specifically that their nervous and reproductive and hormonal systems are still growing and developing, so you have to be very careful about what toxicants or environmental health hazards they are being exposed to during this extreme period of development. And finally, we know from research that they can't metabolize toxicants as well as adults. So we have to be concerned about not only what they're exposed to, but also how long they're exposed to something and the window of which they are exposed, meaning what is the age of which they were exposed to something. So a little more on this topic. Why focus on children specifically? We know that they're particularly vulnerable to environmental health hazards. And we know, like I said, that adults may suffer little or no harm from exposure to a chemical, when that same exact exposure can cause lifelong damage to a child. And again, that's talking about not just what the chemical is, but also what is the duration of exposure and when does it happen. And so you could be talking about, let's just back up a little bit here, it could be talking about lead that you find very commonly in water from old piping or old solder or connecting pieces. You could be talking about lead found from lead-based paint, and so if it's chipping, it's little teeny particles are going into the air and they're breathing it in. We could be talking about chemicals that are found in unsafe plastics. For example, if you're looking at a rubber ducky and a child is mouthing that, ducky, you could have the release of these chemicals into their saliva and thus into their body systems. Other examples just include looking at whether or not playground equipment is treated with CCA, which is chrominated copper arsenate. So is arsenic getting into their systems from the playground that they're playing on? Perhaps they go out to the playground, they play all day, they don't come back and wash their hands immediately. They start eating a peanut butter and jelly sandwich. So that's where you're worried about the contamination from their fingers to their food. So again, we just have to look at their complete environment of what they're eating, what utensils and materials they're eating with, what are the toys they're playing with, what are the shampoos, conditioners, lotions they're being cared for with on their skin, and where are they spending their time. So just looking real quickly here, we have, most of you may be familiar, that the primary law in the United States that regulates the chemicals in our consumer market today is known as TSCA, or the Toxic Substances Control Act. I usually talk about this just briefly to put it into perspective as to why we are so concerned with the chemicals in our market today. So there are approximately 84,000 chemicals in our consumer market right now. And in 1976, we passed the Toxic Substances Control Act, which served to try to regulate or test some chemicals. Because we didn't have enough funding or time to go through and individually test each of those chemicals, what we did was grandfather in 62,000 chemicals, so they weren't at all tested for safety ultimately. Another 22,000 chemicals have been added since 1976. So right now there's 84,000 chemicals approximately on the market. 62,000 chemicals have been grandfathered in, meaning they've never been tested, and another 22,000 chemicals were added in since 1976 when the Toxic Substances Control Act was passed. The concern there has been that the burden has been on the Environmental Protection Agency, the public, if you will, to do the testing on these chemicals and not on the industry, so not on the creators of these chemicals. The testing is challenging because it costs a lot of money, takes a lot of time, and obviously 84,000 chemicals are a lot of chemicals. And so to date, approximately only 200 chemicals total have been tested, and only 5 of those have been restricted or banned. And so that's why we're concerned. That's why we are always looking at what are these exposures for children. The good news is that TSCA has been recently reformed in June of this year. And now we know that I won't get into all the details because we don't have time, but ultimately now the main thing is now we're going to be looking at chemicals to see whether or not there are impacts on human health for the chemical and whether or not that should warrant whether or not they stay on the market. So it's a health-based risk evaluation versus what it was previously, where it was kind of a cost-benefit standard, trying to determine whether or not you should take that chemical off the market. And instead of just looking at whether or not it impacted somebody's health, you would also have to see whether or not there was going to be some kind of economic problem. Could you replace that chemical with something else on the market? So ultimately, the big picture is there's 84,000 chemicals on the market, and we need to be careful about how we are exposed to these chemicals. We know that they're not adequately tested for human health effects because, again, the burden is on the EPA or the public to do the testing after they're already on the market. And we know that we're constantly exposed to these potentially hazardous chemicals. These are not just children, this is all of us. We also have to think about the multiplying effects and how these chemicals interact with each other. If you pick up any product, you could look at the ingredients list and realize it's not one chemical in each product, but it's many chemicals that come together even just to make a simple fragrance. So how are those chemicals interacting, and how might that impact either an adult's environmental health or a young child's environmental health in that extreme developmental window? We know that these chemicals are found in all of our bodies, and ultimately we know that they're not adequately regulated for the impact on children specifically. So that's why the good news is that we're seeing policies and guidance now addressing this emerging knowledge. So we know that, for example, the American Academy of Pediatrics has a policy to decrease children's exposure to pesticides. Real quickly, we're talking about pesticides that anything that tries to harm or repel or kill any kind of bug or insect, an herbicide that you might be using in your yard. Ultimately, we know from the American Academy of Pediatrics, this is just one example, that they even have a policy saying it's very important to decrease children's exposure to these chemicals. Secondly, we know that the American Lung Association and the American Academy of Pediatrics, again, discourage unnecessary chemical exposures, and an example would be to fragrances. So, you know, especially in child care facilities, we know sometimes those can be places that get a little smelly with all those young children. I have 3 young children myself, so I can appreciate that. But we know that often these chemicals that are added are not necessary, and in fact, what they're doing is really just creating more chemical exposures for our young children. So looking at childcare specifically, oops, sorry, can you go back for me, Megan? We know that about 60% of children below the age of 6 are enrolled in childcare and preschool facilities. You guys are very familiar with this population, and many spend up to 40 hours per week or sometimes over. So although everything we're saying is very important for parents, we focus on childcare because we feel that if we educate one caregiver or one teacher or trainer or licensing staff, they can turn around and hopefully affect the education and knowledge and support to, you know, say 20 or 25 families. But ultimately, all of this information is free and applicable to parents as well as childcare professionals. We know that children spend the majority of their time inside, and we know that they're usually inside either within a home or a childcare facility, and that's why we're focusing within the childcare realm. So how well is childcare doing when we think about environmental hazards and toxicant exposures? We are making progress, and that's the good news, and that's a lot of what we'll talk about today. So ultimately, you know, we feel like there's so much work to be done. We would love to see just comprehensive coverage of protecting children's environmental health from toxicants in our professional development and all your continuing education units and credits. In national accreditation, we want to see it in state licensing regulations in every state, and we also want to see it in quality rating improvement systems and Head Start requirements, and we are starting to see that. And so one example today is we'll be hearing from NAEYC and how they've moved forward going through all of their national accreditation standards and determining how to better include environmental health indicators so that children are more appropriately protected from environmental health hazards. Throughout Health in All Policies, I believe it was in year 4, we also worked with the Association of Early Learning Leaders, another national accreditation program, and they did similarly. As far as quality rating systems, we're already working with Pennsylvania and Maryland, and they have embedded environmental health practices that will be improving the environmental health of those child care facilities in those 2 states. And so we look forward to doing more as we progress. Oops, sorry, go back one more time. Thank you, Megan. So just looking at EcoHealthy Child Care very quickly, that's the program that is housed within Children's Environmental Health Network. And ultimately, that's our program that is focusing exclusively on child care. So as Christy said, we try to really recognize where child care providers are at. We know there's not a lot of extra money within this profession, and so we try to come up with things that are not just realistic, but also either free or low-cost solutions. One thing that we offer is a checklist. You can visit our website and find it, but ultimately it's a self-audit checklist with 30 items, and if child care facilities can comply with 24 of these 30 items, we acknowledge them or endorse them for 2 years, just appreciating the fact that they're going above and beyond what's required by child care licensing regulations, accreditation standards up until now, and also quality rating improvement systems. We provide a plethora of free resources, technical assistance via email and phone, and then also we have this endorsement, and to date, over 2,000 child care facilities in the nation have become endorsed. We welcome you to join us. So moving on with this, some of this has already been said by Christy, but ultimately we're going to proceed now with hearing from both Susan Hedges of NAEYC and then Toby Bernstein of the Environmental Law Institute. They were the 2 entities that we worked with this year in the 5th and final year of this cooperative agreement. And in both partnerships, we worked to better implement or create resources or more comprehensively include environmental health related practices and efforts and resources so that we could make those available to the general public.
Great. Hi, am I back on? This is Christy.
Yes, you're on.
Great. Thank you, Hester. That was a great introduction to children's environmental health. Our next presenter is Dr. Susan Hedges. She is the Director of Program Quality Research for the Accreditation of Early Learning Programs at the National Association for the Education of Young Children. She has been with NAEYC for 10 years and in the early learning field for over 25 years. Dr. Hedges is responsible for research and development of NAEYC's best practice content, as well as the measurement tools used to assess these best practices during accreditation site visits.
Thank you, Christy. Susan here.
Hello.
So I'm actually going to start by turning it over to my associate, Megan Hickey. She's going to give a little general overview of NAEYC, its mission and functions of accreditation, and then we'll get into the details of this project and of the new best practices that we hope to be rolling out related to environmental health. Megan is a program support associate at NAEYC. She previously worked as a lead teacher in an infant-toddler classroom, so she has her chops, and as a policy associate at the Early Care and Education Consortium. Take it away, Megan.
Thank you, Susan. So we'll go through this pretty briefly. It's a general overview of NAEYC and what we're doing, just so that we can get into the project details from Susan. So about NAEYC accreditation, so since 1985, NAEYC has offered a national voluntary accreditation system to set professional standards for early childhood education programs and to help families identify high-quality programs. Today, NAEYC accreditation represents the mark of quality in early childhood education, and we have over 7,100 child care programs, preschools, early learning centers, and other center or school-based early childhood education programs that are currently NAEYC accredited. So NAEYC's mission is to promote high-quality early learning for all children, birth through age 8, by connecting practice, policy, and research. We advance a diverse, dynamic early childhood profession and support all who care for, educate, and work on behalf of young children. So with this project, the NAEYC and EcoHealth Child Care, we have a shared commitment within both organizations to promote the development of child-focused, safe, and healthful environments, educate members of the early childhood community, and elevate public awareness of environmental hazards to young children. So within what we looked at in NAEYC is our accreditation standards. So NAEYC's accreditation standards work to ensure the quality of children's daily experiences in early childhood programs and promote positive child outcomes. And we have 10 standards, and within that we have criteria. So just an overview of that, we have, like I said, 10 standards, and within that we have, at this time, 400 plus criteria. So they focus on best practices in the field and the benefits to the stakeholders in the early childhood environment. And those stakeholders are children, teachers, community partners, and program administrators. And what we look at is kind of these 4 areas, so how they impact the children, the teaching staff, the administration, and the partnership within families and community relationships. And now I will hand it over to Susan to go over the project.
Okay, hi, I'm back. So let's talk about the work we've done in the last 2 years with the Children's Environmental Health Network. We worked hard last year and got a lot of work done. Just briefly, what we did last year when we started this project is we took a look at our existing environmental health related criteria that were already part of NAEYC's accreditation best practices. And we identified some. I think it's fair to say, as Hester mentioned earlier, that accreditation does address environmental health as it exists right now, but it can be improved and expanded for sure. And we did the work. We started with what we had, and then we worked with the staff at the Children's Environmental Health Network to identify other evidence-based best practices that were not included in our current recommendations to programs about best practices. And so we expanded the content of recommendations for environmental health to programs. We also constructed a bibliography of resources for environmental health practices. As was mentioned earlier, the Children's Environmental Health Network deals in evidence-based practices, and so does NAEYC. In fact, all of our accreditation standards and criteria are evidence-based. And so what was important from the start is that they help us understand the research base behind new practices that they were recommending that we incorporate into our recommendations to programs. We also asked them to help identify the regulated environment for environmental health practices. This can be federal regulations from, for instance, the Environmental Protection Agency applying to all kinds of organizations and businesses. It could be Head Start regulations that often are sort of also setting the model for practice nationally. Or more commonly, it's things that are regulated by state and local governments. And again, this could be in their child care regulations, or it could be in their building regulations. Those of you who operate child care programs are probably aware of certain things that are law for any business or group setting, and then other things that are found specifically in your child care regs. That's important for us because accreditation exists in a context where there are other means of monitoring and setting standards, and we wanted to understand sort of what's going on, how different it is from state to state, and what was sort of in need of national attention. So we did that all last year. We wound up with a draft version of updated content of our own, a really nice bibliography of not only research evidence, but the bibliography also includes resources that we hope to pass along to programs, websites you can go to, and books and things you can read that will help you dive deeper into certain environmental health topics if you need to. And also, as I say, we have that kind of an overview of the regulatory environment. So what did we do this year? Well, we're actually still doing it, but what we've done so far this year was, okay, so we drafted these potential revisions to our best practices, working NAEYC staff, working with the CEHN staff. But really, we wanted a protocol to have outside expert review of this. And so we did. We developed a protocol for how we would gather expert feedback on these proposed revisions, and really on any proposed revisions. Environmental health is our topic in this project, but NAEYC is in a position where we are ready to review and update a lot of our best practices, a lot of our content. And this is where we started because we had this opportunity, which was just great. So we identified experts and convened a panel to review the proposed revisions and the supporting evidence for them, and for these experts to suggest additions and changes. So our panel was made up of some environmental health experts that were recommended by CEHN, directors of accredited programs, so people with real on-the-ground experience that, while looking at these practices, would be asking the kinds of questions you might ask when you get a look at this in a few minutes. Things like, but can we do this? Is it practical to do it every day or to accomplish this? And then we also had some early childhood system administrators, for instance, people from the General Services Administration, from some large-scale programs, to review these and look at them from the administrative aspect too. So we did, when we went through a process, so they reviewed, they commented, we went back and forth, and then we came back to us working with the Children's Environmental Health Network to finalize a draft. Now, our process at NAEYC for proposed criterion changes is that we have our own outside governing council, the Council for Accreditation. They have to do the final approval of criterion changes. So what we're going to show you today is actually draft changes. We do expect most of them to be approved, but the council has not acted on them yet. That's the council will be meeting within the coming few weeks, and so we expect to have a final version approved and out within the next month or two. And so what remains for us to do after we work with the council and get final approval of these changes is to communicate the approved revisions and to enact them over the coming year. So a little more detail about that. The first kinds of changes that we made that we're able to enact immediately are just changes to our guidance. Those of you who are NAEYC accreditation participants, you know that we roll out guidance revisions twice a year, on October 1st and April 1st. The Council doesn't have to approve guidance. They only have to approve the actual content of criteria. So we started by making some immediate guidance revisions to existing environmental health criteria and indicators. Those are already posted on our website with the October guidance updates. Those are posted now for you to start to see and engage, because they will become effective as guidance on October 1. Later this fall, we'll be orienting NAEYC staff, NAEYC's assessors, and the public to approve changes. And then when we hopefully roll out these other revisions, which are like updating the content of criteria, we will have new and updated indicators in existing criteria. And I'm going to show you examples of all this. So if it sounds a little confusing, you'll see how it plays out. We're going to get to the actual examples in a minute. So there's some new indicators, there's some new guidance for indicators, and there's some entirely new criteria. And then we will start assessing the things that are content that is totally new is going to be assessed as emerging practices starting October 1st. Again, for those of you who maybe aren't as familiar, what it means to call something an emerging practice in our system is that we put it out there, we say we do recommend this as an evidence-based best practice, but if you're being assessed to earn accreditation, we will assess it, and if you pass it, we'll give you credit for it, but if you don't pass it, we won't count it against you. So there's a period during which we're looking at these emerging practices, seeing how they're being taken up, getting continuing feedback from programs about what the challenges might be, and then eventually making a final decision about whether to keep them or not. And as I said, this process that we did for these environmental health criteria really feeds into a larger process for us to do ongoing updates of all of our systems. So we saw this as a pilot process. And kind of what we've extracted as maybe an ongoing process is to start with a small panel of experts to update evidence and to update draft revised best practices, then convene a larger diverse panel of experts and stakeholders to review the draft revisions, comment on them, and suggest amendments or additions. To seek stakeholder comment, which we also have done throughout this process, to make final revisions, and to get approval of our council, and then phase them in as emerging practices. With that in mind, let's go to the specifics about what we had and what we changed. I think this will be, we're going to kind of go through it piece by piece, but I think this is where it's interesting, and I think you're going to see a lot of this being what was referenced earlier by Hester and Christy about the kinds of things that are important in all environments for children, but certainly in childcare environments where children spend many hours and there's many children together. So we have, as Megan mentioned earlier, we have 10 standards that organize all of our best practice content for accreditation. Standard 2 is our curriculum standard. It's about practices in the classroom, things that are taught and how they're taught. We identified 2 criteria in our curriculum standard that do address environmental health issues. We're going to show that to you in a minute. In our health standard, Standard 5, there were 4 criteria that address things that are related to environmental health. And in Standard 9, which is our physical environment standard, there were 10 criteria. And actually, Standard 9, all of our standards are also subdivided into topic areas. And one of the topic areas is environmental health. Interestingly, there are also criteria that are in other parts of Standard 9. So 10 criteria. We started with these 16 criteria. Now, all criteria have indicators. Those are subsections of a criteria that are actually rated. So I wanted to show you this indicator by indicator, because I think it conveys how much we actually just added in this revision. So it started with those 16 criteria had 28 indicators. We added to the existing criteria, we have added 17 new indicators. So we've expanded the existing criteria with more detail. We've also created some entirely new criteria, 4 entirely new criteria, and those 4 criteria have 14 indicators. So we started with 28 things we rated related to environmental health, and we added 31. So we've more than doubled the rateable content. We also have added additional definitions of terms. We've added, in our guidance, you will see additional linkages to resources. We've added more examples of what kinds of things we're talking about. So we've really kind of enriched our content in a number of dimensions related to environmental health. So let's show you exactly what some of this is. Let's start with our criterion 2K01. This is, remember, standard 2 is the curriculum standard. So our current criterion, we have a criterion that says children are provided opportunities and materials that encourage good health practices, such as serving and feeding themselves, rest, good nutrition, exercise, hand washing, and toothbrushing. We've added, if you look to the right, we've just added something to the examples in the such as part of this criterion, such as washing fruits and vegetables before consumption. That this is one thing that's taught, basically, is what we're recommending, that you also teach children to wash fruit and vegetables before consumption. Now, when we ran this past the expert panel, the people, the part of the panel that were directors said, okay, but let's clarify, you're not talking about children washing all the fruits and vegetables that are consumed, are you? And we said, no, we're not talking about that. You'll see in the health section that we also do recommend that we make sure everybody understands back in the kitchen to wash all fruits and vegetables. But this is about curriculum. And so we just want to say you would be doing this occasionally in various kinds of learning settings. So this could take place during gardening, during cooking or tasting projects, that you emphasize that we do wash fruits and vegetables before consumption. So this is an example of a change where we didn't even add a new indicator. We just added a little new content to an existing indicator. Here's an example. This is also from the curriculum standard. Here's an example of where we added one of those new indicators. So the existing criterion said children are provided opportunities and materials to learn how people affect their environment in positive ways and in negative ways. We've added a third indicator that says the program creates opportunities to educate families on eco-healthy practices. So this criterion started as a criterion that is about educating children about environmental practices as part of curriculum. You see on the right side, we're showing you the environmental health checklist item that that speaks to the issue of educating families as well. And so we've incorporated it into this criterion content, 2L08, because the criterion was already about educating about environmental health, and we were expanding it to capture education of families. We thought that was a pretty good fit with an existing criterion. If you, as I'm going through this, if you think of specific questions you want to ask about these, you can go ahead and enter them into the question thing, right, Megan?
Yep.
And Megan is going to be kind of tracking these things as they go along. We're not going to address questions till the end, but if these questions come up for you right now, please go ahead and enter them into the communication function. Now let's move to standard 5. It's our health standard, and I'm just going to show you some individual indicators that have been added to existing criteria. I'm not going to show you all the criteria because it's just a little too much, but let's just talk about what some of these indicators are. So we've added an indicator 5A06B, vehicles, buses as well as parents' automobiles do not idle in the program's parking areas. So the existing criterion 5A06 has other indicators that are about air quality. And this is one that's added that we didn't have, an emphasis on vehicles. So this would be about buses, which the program may be able to control, and about parents' automobiles, which the program can't directly control, but they can educate parents and tell them this is a practice. You can state this as a practice. Parents, please don't idle automobiles because that's polluting the air quality right in around the program. The next, there's a series of indicators added to 5B03, which is about food preparation. So here's where we see the health aspect of the thing we just covered, where we teach children to wash fruit and vegetables. We also make sure that the people, as a health practice, whoever is engaging in preparation of our foods, know that all fruits and vegetables are thoroughly washed prior to eating, from a health standpoint. There's also we've incorporated new material about plastics. Actually, you're going to see that throughout. We really had not, our current criteria were created over 10 years ago, and really plastics were not addressed as an environmental health issue. So there's a lot of addition concerning plastics, and this is the first recommendation is that staff never use plastic or polystyrene containers, plates, bags, or wraps when microwaving children's food or beverages. We will have resources also if you want to know why or understand that better. There'll be ways you can find out more about that. But understand that it's very bad to have heat and plastic and food all in the same place at once. Not a good idea. And kind of to go along with that staff choose and use dishwares, baby bottles, sippy cups, drinking cups made of glass. And if you haven't checked recently, you should know that you can get glasswares covered with silicone sleeves that prevent breakage, or polypropylene, polyethylene options. There are some kinds of options to glass that are still okay. These are for beverages. And for eating. The next one, that staff discard plastic, ceramic, or glass dishes and containers that are chipped, cracked, or scratched. At that point, if they're not whole, they can become contaminated. So this is, again, an important recommendation about not letting hazards into the environment, into the food environment. Sorry, there we go. Some more stuff in the health standard, and these have to do with cleaning products, cleaning and disinfecting. These are a lot of new recommendations. You'll see at the last one on the bottom there is we're adding something to an existing indicator, but let's start at the top. When you're cleaning, we recommend that you use fragrance-free, third-party certified, or least toxic products. And we've embedded right into that some important websites, including an EPA website and some very dependable nonprofit organizations that keep track of this and can give you unbiased, good information about what these products are. Remember, Hester mentioned earlier that fragrance-free environments are very important. Least toxic product use is very important too. Keep in mind, this is for the children and this is for the staff. Everyone in a child care program gets a lot of, if you're doing it right, you get a lot of exposure to cleaning agents. So given that cleaning is a constant part of maintaining an overall healthful child care environment, you want to think hard about using least toxic products and fragrance-free products that do not trigger allergies and asthma attacks and things like that. Chlorine bleach and other disinfecting and sanitizing products should be EPA registered. Yes, that is a thing, even for chlorine bleach. That's something I didn't know before I started this project, but I know it now. They should be used only for their intended purpose and in strict accordance with all label instructions. You know, 10 or 15 years ago, chlorine bleach was the disinfecting and sanitizing agent, and it is still an agent that many programs use. It's very inexpensive, and we recognize that chlorine bleach may be one choice that you make, but many other disinfecting and sanitizing products are on the market, so you do have choices. But look for things that are EPA registered and be aware that all of these have label instructions, and it can be, if you don't mix them in correct proportions, you can either fail to disinfect and sanitize something by making them too weak, or you can make them too strong and introduce other problems. If you've ever overmixed chlorine bleach, you know it can wreck your carpets, make the paint blister on your walls, and various other bad stuff. So We also point out the chlorine bleach solution is mixed fresh daily, and that the concentration and the bleach water solution ratio is posted. This is a best practice recommendation to make sure that all staff at all time have access to the correct mixing instructions, so that they can mix it fresh daily, and so that you're least likely to have errors made in making the concentrations. So this last one that we're looking at here is about ventilation and cleaning instead of sprays, air freshening chemicals, or deodorizers. All of these things that try to control odors by bringing in other odors are a bad idea. And we've added, just to be clear about it, scented and unscented candles and air fresheners are not used, and the use of personal fragrances is discouraged. That would be for pretty much everybody in the environment. It doesn't mean you don't use deodorant. It just means that you do look for at least fragrant options, and you don't add personal fragrances to your body when you're working with children in close quarters, especially infant and toddler staff, but really everybody. Let's go to the next one. This is now in Standard 9, which, remember, is the physical environment standard. And the first topic, topic A, is about general equipment. And one indicator for 9A03, we had that non-disposable materials are durable and in good repair. We've added to the guidance there, you see in red it says changing table pads and nap mats. We've specifically kind of raised that up as something that you keep an eye on to make sure they're in good repair. And we've added the last sentence there in the guidance. Foam containing products and furniture have no exposed foam or stuffing. That's the problem, is the foam and stuffing inside of table pads and nap mats and things like that can be harmful if they are exposed to children in the environment. So this is just something in particular to be careful about when you are assessing your equipment and materials periodically to make sure that they're still in good repair. We've added an entire indicator here, and this one is going to be challenging. When we ran this past our experts, they had some concerns about this. Furniture, we recommend that furniture is made of solid wood or products, composite products with low volatile organic compounds, rather than items made of engineered wood, such as plywood, particle board, or medium density fiber board. I'm sure all of you out there that run programs, you know what we're talking about. And those of you who don't run programs, we're talking about the kind of stuff you could get at, say, IKEA. And I'm not knocking IKEA. IKEA is great. But as Hester mentioned, children are more sensitive to a lot of things. And when you have a lot of particle board or fiberboard products in an environment that children occupy for hours and hours every day, this can be a concern, because furniture made with volatile organic compounds in them, so, you know, fiberboard is like wood and sawdust mixed with glue and stuff. That can be off-gassing for quite a while. That is, it is putting chemicals into the air around you. I know that you might look at this and go, oh my gosh, if you're asking me to replace all my wooden furniture, that's going to be very expensive. And at this point, I want to stress that these are recommendations that would come on board for accreditation as emerging practice recommendations. You would not have to meet these in the coming several years, but we need to put them out there. This is what, you know, there is solid evidence recommending that this is the way environments with young children in them should be operated. Here's an entirely new criterion for Standard 9, Topic A. So Topic A is about indoor and outdoor equipment, materials, and furnishings. These are things that were recommended through the Children's Environmental Health Network's best practices that we just didn't capture anywhere, and we've kind of put them together into an all-new criteria that says staff select and use equipment, materials, and furnishings that are environmentally healthy. That this is another factor you consider when you're choosing equipment, materials, and furnishings. And then here are specifically some kind of high points about what that would mean. It could mean other things than what's listed here, but here are some very important aspects of making environmentally healthy selections. that your floors are covered with easy-to-clean, eco-healthy surfaces, that you do not have wall-to-wall carpeting. Again, this is one indicator we're recommending. If you are currently in a program that has wall-to-wall carpeting, you may have to live with it because of what you've got. But when you have an opportunity to replace or remodel, please consider replacing wall-to-wall carpeting with something else. As Hester mentioned earlier, stuff gets into wall-to-wall carpeting that you cannot clean, no matter how much you use an extraction device or something like that. Plus, every time you have to clean wall-to-wall carpeting, you are pulling up molds and mildews into the air. So we are recommending that you not have wall-to-wall carpeting. Again, this would be an emerging practice. It would not be assessed for accreditation immediately in terms of you getting credit. Art supplies are non-toxic. I'm sure most of you are doing that right now. Toys are screened for lead, phthalates, and other hazards, and we have guidance. I didn't reproduce it here. We got a lot of information on what phthalates are, so you can understand what phthalates are. It's those soft plastics that rubber duckies and shower curtains are made of, and it's in other stuff too. There's lots of evidence that this is a very unhealthy thing to have in your environment. That soft toys are labeled PVC-free or phthalate-free. You should be able to find that in most places. So when you're going and selecting things, look for labels that say that. Digital thermometers and thermostats are used. If they're used, that you use ones that do not contain mercury. Mercury contamination, like lead, is a very serious issue. It's a heavy metal, basically. You don't want that anywhere near children if you can help it. We recommend that you sign up to receive Consumer Product Safety Commission product recall notices, and that you actually scan them and look at them, and when you start doing that, you will see there are ones that are relevant to both you and your family. These are notices that aren't all about childcare environments. Some of them are more about personal products that would be in homes. But I hope that you see this as part of your mission in engaging families and educating them about important environmental health practices, is that you can become a conduit for getting important information to families, as well as informing yourself about things that are emerging that you may need to know in your program. How we doing, Megan, on time? Okay, I'm going to wrap it up pretty quick here. This is a reminder that outdoor wooden structures should not be treated with chromated copper arsenate. This is a new criterion in the Outdoor Environmental Design Standard. I'll let you look at that. If you have such equipment, you can use sealants to help fix it. This is an addition to criterion 9C09 that emphasizes that when you're looking for maintenance issues, that you keep an eye out for flaking or peeling paint, chipping floor tiles, peeling or deteriorating caulk. These are things that are added specifically to raise up maintenance issues that are also environmental health issues, because peeling paint can be a lead hazard, chipping floor tiles can present an asbestos hazard, and other kinds of things. So this is why these have been added. We had a brief criterion, 9C13, about renovations, and we have really built it out and added other things to consider and keep in mind when you are doing renovations, or doing painting or carpeting. And there's a lot of additional guidance I didn't reproduce here, with some wonderful resources that you can go to, that just when you need this, you'll be able to go to it and learn more, everything you need to know. Here's another new criterion. We're recommending that you implement comprehensive recycling to the extent that these are supported by your local waste management laws and infrastructure. We realize not everybody can do this. You have nothing to do with it if there's no place for it to go. But if your municipality or your county or your state supports recycling, please do it and consider it. Again, we go back to that curriculum standard we started with. It should be part of the education of your children and their curriculum also, that you are doing it and that you are modeling the practices that you're going to recommend for these children as we go forward in the 21st century. Used batteries and fluorescent and compact fluorescent light bulbs should be securely stored and recycled at a hazardous waste facility. They are hazardous waste. So that's a recommendation. 9D is the environmental health criterion. We're adding that if you are assessed for radon or radiation, that be done by a licensed health professional. There are some self-test kits for some of these things, but they're not as reliable. Hopefully this is something that doesn't come up that often. It may come up when you first come into a building or just very periodic recertifications. For buildings that have lead-based paint, that are older ones, that you follow federal EPA requirements before disturbing them. And again, we have great resources linked to this recommendation. This one is about drinking water, and I'm going to let you all look at this later. All I have to say is one word about this: Flint. Okay, Flint, Michigan. You will get why all of this is important. We cannot count, just because our drinking water is produced safely by our municipality doesn't mean it's getting to our taps safely. So, and this one in environmental health raises up, you know, we had a criterion that that said you keep the room, you maintain heat, cooling, ventilation, and humidity levels, and it was more about comfort, that indicator A that you're looking at. We've added to indicator B to emphasize that humidity levels really need to be tracked and kept between 30 and 50%. And this is not just about comfort. It is about environmental hazards, growth of mold and mildew, which can be very harmful to some people's health. And we've added guidance about how you can actually measure that. There's a thing called a hygrometer. Again, did not know that before I did this, so I've learned with you guys too. No smoking. I'm sure you all don't allow smoking in your facility. Have you considered your vehicles? Not just when the children are in them, but when the children aren't in them, that your drivers don't smoke in vehicles. And we include vaping in the non-smoking. I'm going to kind of go past these. This is about your pesticide use and a little added detail updated. And then we have a entirely new criterion that captures other issues related to lead and other heavy metal contamination, including notice C is about the use of walk-off mats at your entrances so that you are not tracking outdoor contaminants into your facility where children might be crawling or on the floor a lot. So it's something important to be aware of. And again, we have you'll see there at the bottom, some good resources related to it. Some of this was challenging. We know that environmental health is not the only thing that you do. We know that busy directors and administrators have many, many things on their minds. But this is like, you know, basic health and safety. You know, at the end of every day, you have to deliver these children back to their families. And among all the many, many things you do with them, you have to keep them healthy and safe. So this is very important content. We worked very hard to figure out what level of detail to include in the guidance, what to include in the criteria, what kind of support to build up. We hope you will appreciate the effort that went into this. We're very pleased with it. So in the end, we updated our 16 existing criteria. We developed those 4 new criteria. We got the resources. We got a regulatory overview. And we have created a model for expert review that we're going to go forward with in our other practices. Here's our information. You guys will be getting, I think you'll be getting this afterwards, so you'll have it. And that kind of finishes with us. So we are now, hold on, Megan is taking it back to Christy.
Great. Wow. Thank you, Susan and Megan. That was a really great job of summarizing such a big and ambitious project and 2 years of really solid, excellent work. So thank you. Our next presenter is Toby Bernstein. Toby is a senior attorney at the Environmental Law Institute, a nonprofit research and education center located in Washington, D.C. Toby is the director of ELI's Indoor Environments and Green Buildings program, which works to strengthen governmental programs and policies that address indoor environmental exposures in childcare, schools, homes, and other buildings.
Thank you, Christy, and thanks also to CEHN and NACCE for organizing the webinar. I'm really happy to be here and to share with everybody a little bit of our work in this area. I wanted to give you a little bit of background on the Environmental Law Institute, just so you'll have some more context for our work. ELI is a nonprofit research and education center. We were established in 1969, and our mission, broadly speaking, is to improve environmental law policy and management. We work on many different environmental issues, both in the U.S. and internationally. Christy mentioned a little bit about the program that I manage, our Indoor Environments and Green Buildings program. Most of that work involves synthesizing information about state indoor environmental laws and regulations and making that information available through a lot of different types of publications that you can find on our website, and I'll put that information up at the end. And many of the materials we produce focus especially on the school and home environments. The work I'm going to describe now is part of a project we began a couple of years ago in partnership with CEHN to address indoor environmental exposures in child care facilities. And the aim of that project is similar to the aim of our program generally, to provide support for strengthening state policies and programs to improve and protect environmental health, in this case in licensed child care facilities where so many young children spend their days. And we've also worked this past year on follow-up to some of the work that we began a couple of years ago. And I'm going to try to forward my slide. There we go. In early 2015, we released the findings of our project research in a joint ELI-CEHN report titled Reducing Environmental Exposures in Child Care Facilities, a Review of State Policy. Purpose of the report was to enhance understanding. Sorry, I'm on the wrong slide. Let me just go back. There we go. I have a quick trigger finger here. I don't know. I didn't realize I advanced it. The purpose of the report is to enhance understanding of how existing state laws and regulations across the U.S. address key environmental health issues in the child care context, and also to highlight some notable non-regulatory initiatives. So if you've heard really throughout the webinar thus far, there are a lot of environmental health issues that are relevant to the child care setting. Our focus was on indoor air quality issues. We identified indoor air quality issues that are associated with significant health effects and are the subject of state policies currently. And we tried to cover as many as we could within the resources of our project. So this slide shows you the 10 different issues that we cover in the report. I just want to point out that the report is not a state-by-state listing of policies. We organize it by topic, and for each of these topic areas, we provide a broad overview of how states across the U.S. address the issue through their laws and regulations. And we also provide examples of notable policies in the different areas in different states. We cover in the report not only child care licensing laws and regulations, but also other state laws that address the particular topic. So, for example, smoke-free laws, laws dealing with pesticides, etc. And to do this research, we compiled and reviewed laws and regulations in all of the 50 states. We used electronic databases, and we looked at state administrative code web pages for those official versions of state regulations. I'll also point out we did not review in any comprehensive way less formal policies like guidance documents or application forms that state agencies may create, but those are also used to establish best practices in some states, and we tried to highlight examples as we found them. So there isn't really time today to go into or to review the state policies we discussed in the report in any detail. I just wanted to mention a few of our very general findings. So one thing to note is that states have established a wide variety of policies, both within and outside the child care licensing system, that address environmental health issues in child care. But only a few of the states actually address all of the environmental health issues that we covered, and no state addresses all of the issues comprehensively. So the bottom line is there is room for policy development in every area that we cover. And all states can benefit from reviewing their policies and identifying priority issues for new or revised laws, regulations, or other policies. It's also, I think, important to keep in mind that there really isn't a one-size-fits-all policy for most of the issues that we looked at. And we don't provide model language for laws or regulations, but for most of the areas, for most of the issues that you saw on the earlier slide, there are examples of state laws and regulations that other jurisdictions can use to strengthen their own policies. So, for example, in the area of radon, which was mentioned a few minutes ago, there are several states that now require licensed facilities to test for radon. Most of those states also require mitigation of high radon levels if those are found. And there are many other states in the U.S. that have documented and considerable areas of high or moderate radon potential, and that could benefit from that type of a policy. In the area of smoking, although, as was mentioned, in general, in most states, programs do not permit smoking during the hours of childcare. There's also a small number of states that prohibit smoking in all types of facilities at all times, even outside of childcare hours, and including in childcare vehicles. And some states have also begun to explicitly include e-cigarettes in their no-smoking policies. One other issue, pesticides. That's another area where there are models that states can consider. Over 1/3 of states restrict pesticide use while children are present, and several states restrict the types of pesticides that may be used. There are also a handful of states that require licensed facilities to have an integrated pest management or IPM program or plan. And then one other issue I wanted to mention is the issue of environmental site contamination, or as we refer to as siting or site location. There are some state licensing regulations that prohibit hazards on the site of the facility generally, but our research found that those types of provisions are generally not implemented to require any type of specific review of either the prior uses of the site or of other potential environmental hazards. But there are a couple of states that do specifically require that type of review. And then, the focus of our report, let's move back, sorry. Okay, now one more. The focus of the report was on laws and regulations, but we also described a number of notable non-regulatory or voluntary initiatives that states have undertaken to advance environmental health best practices. Recognition programs, here we're referring to programs where providers who meet the program standards receive certain benefits. Two that incorporate environmental health that we describe in the report are Indiana's, which has a 5-star environmental recognition program that's managed through the State Environmental Agency, and also Pennsylvania, which Hester mentioned briefly before, their quality rating improvement program, a Keystone Star, has a significant environmental health component, and as she mentioned, other states like Maryland are moving also to add environmental health best practices to their quality rating systems. Education and outreach is another area of a lot of state activity. We describe a number of these programs. California, the Child Care Licensing Program has produced a lot of different publications that relate to environmental health. In Connecticut and Minnesota, the health agencies have developed manuals on asthma triggers in child care facilities. Technical and financial assistance, we talk about a couple of examples there. Minnesota, their health agency conducted a pilot project which provided grants for radon mitigation. And then Pennsylvania's Quality Rating Improvement Program offered mini grants to assist programs that wanted to achieve some of those programs' environmental health standards. And of course, there are others. We talk about some of the examples, but there are others throughout the country of states that are that may not be changing their laws and regulations, but are working in other ways to help providers adopt these practices. I wanted to also talk about a paper that we published later after the earlier report, about a year ago in August of last year, on state policies that deal with drinking water quality in child care facilities. And this was a paper that was funded by CDC's Agency for Toxic Substances Disease Registry and also the American Public Health Association in connection with a project that ATSDR has been working on relating to siting of child care facilities. So the primary focus for this paper was on site contamination and how it might impact drinking water. And like the report I just described, this paper also aims to enhance understanding of the existing state laws and regulations on the topic around the country. We look not only at child care licensing laws and regulations, but other types of state policies like safe drinking water regulations, environmental health codes such as food or sanitation codes. And again, the emphasis is on requirements for non-public water systems like wells. Most child care facilities do get their drinking water from public water systems, and those are governed by the Federal Safe Drinking Water Act. But there are about 15% of people in the U.S. Who get their drinking water from wells or other private sources that aren't covered by the federal law. But those are more vulnerable to environmental contaminants that may be on the property. And although the Federal Safe Drinking Water Act doesn't apply to those wells, state drinking water laws may establish requirements that go beyond the federal law. So we looked at those as well as other types of state laws to determine what they say about requirements for drinking water in licensed child care facilities. We are going a little too fast. Let's try that. Okay. So a few general findings from this report, and there are multiple areas and levels of regulatory authority that may come into play in addressing drinking water quality in licensed child care. Child care licensing agencies themselves may have a direct role to play, but they're usually not the agency with the drinking water expertise, so they may rely on approval of drinking water systems from other state agencies. Local agencies may also be key players here. But the bottom line is for any given state, it's important to look at multiple laws and regulations and agencies to determine what the drinking water requirements are. State laws and regulations vary considerably in how they address drinking water quality in child care facilities. Beyond the federal requirements, which states implement, there really isn't a single approach or model that you'll find in most states. There are many states that require testing of private water supplies as part of the child care licensing process. This is really the primary oversight mechanism, and a number of states do include in the child care regulations the requirement that the facilities submit drinking water test results. In some cases, you'll see testing requirements in the food code or the environmental sanitation code, and these types of regulations typically will specify testing for bacteria and or nitrates. Beyond the state requirements, and as I mentioned before, there may be additional local requirements as well. So the existing state policies offer a starting point for states considering strengthening their laws and regulations. Again, no single model that we call out, but the paper is intended to show the different types of laws and regulations that exist. I mentioned again, the focus here is site contamination and private wells. This was not a report that focused on lead per se and requirements for testing for lead, but I will just tell you that those requirements are not, they are few and far between. Okay, so we spoke with licensing officials as part of the research for our report. We also spoke with a few state licensing programs over the past several months as follow-up to try to get a better understanding of what environmental health issues are of concern and how states use their existing regulatory authorities to address those issues, and also what challenges they have when they're implementing those laws and regulations. So, one challenge relates simply to the fact that there are multiple state and local agencies that are involved in implementing these types of requirements. And this raises the issue of coordination among agencies when the authorities really may be fragmented, especially for certain highly regulated issues like drinking water, pesticides, even for siting. So interagency collaboration and coordination is really important. Connecticut's SAFER program, which addresses environmental site contamination risks, is one model that we talk about in the report that really tries to address this issue and sort of bridge the fact that the issues are dealt with by so many different levels of agencies. Environmental health is only one of many issues addressed by licensing programs, and this was raised before. It really goes without saying that licensing programs are responsible for addressing a very wide array of issues and standards. There are some states that have incorporated a number of environmental health measures right into their licensing regulations, and there are other states where these requirements are scattered throughout different agencies. And another model is to concentrate the environmental health standards for child care in a health agency or other agencies with expertise in health. And this can be effective provided there is the oversight of those requirements is coordinated with the licensing process. Colorado is an example of a state with fairly comprehensive child care sanitation regulations implemented by the health agency, and those were just revised recently. Another issue is resistance to changing longstanding practices. Certainly establishing best practices in environmental health may mean changing operating practices, but they can become accepted over time. Smoking is one example that's by now become largely accepted as something that is important to change, at least during child care hours. Another example is air fresheners. The use of air fresheners is a common practice really throughout society, not just child care facilities, but it is a potential source of chemical exposure, and the best practice is not to use these. But if the state regulations don't prohibit the practice, it may be difficult for an agency to disallow it. Vermont is an example of a state that has had a long-standing prohibition on the use of devices that diffuse airborne chemicals, and they have a number of examples. And Colorado's recent revision to its regulations changed its policy to now prohibit chemical air fresheners, scent-enhanced products, and a number of other items that are listed in that regulation. And then finally, concern over the cost of implementing environmental health best practices. Certainly, some issues do raise cost concerns. If you find you have a problem with radon or lead, asbestos, mold and dampness, drinking water, these may involve costs to fix the problems. State agencies may seek to connect providers with resources that are available in other state programs but maybe hadn't been used in the child care context. Some states, as I mentioned, incorporate environmental health issues into the quality rating improvement programs or other voluntary programs, and there may be some potential funding associated with that. But this is certainly a concern that needs a greater attention in order to make sure that children in all facilities, including those serving low-income communities, can benefit from these best practices. Before I close, I just want to mention a few areas that we identified for further research and are possible next steps for us, developing case studies of successful implementation of environmental health policies, collecting and analyzing and disseminating information about federal, state, and local sources of financial assistance for providers to implement these improvements, and then convening state and local officials to share best practices and lessons learned. And I know I'm running out of time, so I'll just throw up this slide which has the websites for the reports that I mentioned, as well as our general program website where you can get a lot of other materials. Please feel free to contact me if you have any questions about our reports or about anything that's going on in your state that you think I can help you with. Thank you.
Great, thank you, Toby. That was excellent information on some very important work exploring regulatory challenges to implementing environmental health in regulation and licensing and child care. So thank you very much. Again, all of this wonderful work that you've just heard about was supported through a cooperative agreement with the Centers for Disease Control and Prevention. So we definitely want to thank them, and also our partners, NAEYC and ELI, and today's speakers, and thank all of you for joining us for this webinar. We hope that you found it very informative. We're going to move on to a question and answer period. Please make sure to take the brief survey that will be emailed to you afterwards. We have just about 7 minutes for questions. I'm going to leave this contact information up for each of our partner organizations. If we can't get to all of the questions on this webinar, our presenters, we can answer the questions that aren't answered during the webinar and send around a follow-up email to everyone with the answers. And you could also contact one of the presenters as well. So let's move into some questions here. Okay, the first question we have is, this would be for Susan.
Yes, I'm here.
Hi. Does indicator 5A 6B include car rider pickup time? So this, I think, is the idling, the new idling criteria.
Yes, and I'm noting, I'm looking at the next question afterward, after that one, which is also about idle time. Let me start with the second one. The second one says, okay, we live in a very rural area and experience minus 40-degree weather where vehicles need to idle or they will not start. How do we address this to meet this practice? It's interesting that you bring this up. This was something that in our expert review process, this very question was brought up. And actually, there's the other end of the question, which is we live in a 110-degree environment, and we can't stop running the car, or the car will superheat within a period of a minute or two. There is, I didn't put on these slides, but there is guidance accompanying this best practice recommendation that does basically address these and say, you know, basically it's understood that it wouldn't apply when you have to for other reasons when you have to idle. So to get back to the other question about does it include car rider pickup time, yes, it does include it. Again, within the limits of reasonableness, which is to say, if you're in a moving car line, you can't not idle. But if you are stopping to pick up your child and you're just running in, please turn off your car, because just running in can take you several minutes. And so, you know, there are basically common sense limitations to this recommendation as with everything else. But definitely to answer the minus 40 question, no, we understand you have to keep idling. I did we actually go out and do accreditation site visit around the country, and I did one in Fairbanks, Alaska in February. And I was in a hotel where there was a Mack truck that idled in the parking lot the entire night because it couldn't fit into the, apparently it couldn't access all the parking spaces, which all had engine block warmer plugs in them. So this truck just idled all night. So yeah, I do get that we get that there's limitations to there's other reasons why you can't always do what would otherwise be a best practice. So when it's not -40, we hope you will not idle any more than you have to. So what else do we have here?
The next one is, do we have any suggestions about the use of products to make sensory materials, such as liquid starch, to make glurt?
Well, I think that I don't have any recommendations other than capturing the issue of non-toxicity, and you can look at pretty much everything that's sold in the child care market should be addressing non-toxicity. I would, if you're buying products, you should assure that they're not toxic. I guess if you were buying from markets or discounters or something where, I don't know, things are coming in from other countries that are not regulated for this market, I would be cautious. But if you're buying things that are sold commonly as supplies to child care centers, you should be able to find out information about the product and it not being toxic.
So this is Hester. The one thing I would add to that is when you're looking for products for art supplies, the easiest thing to do is just pay attention to criteria on the back of products and whether or not they're certified by the Art and Creative Materials Institute. It's acmi.org, I believe. Christy, is that the right address?
Yes, I think so.
I think that's what it is. But ultimately, it's Arts and Creative Materials Institute. And the majority of what you're already using is very likely approved by this entity. But ultimately, this is a nonprofit third-party entity that's research and certifying art products to make sure that they are eco-healthy.
Thank you, Hester, for adding that. And actually, you're reminding me that I'm fairly certain that we have that link in the guidance that accompanies the new criterion that talks about non-toxic materials. I think we capture that link in the guidance. So that is a good example of where we're trying to bring you resources that will allow you to really explore these things when you need to in more depth and get more detail.
Right.
We are required to use.
Go ahead.
Go ahead.
We're
required to use bleach by our DFS licensor and our sanitation inspector. How do we use natural products when you don't? If you are required to use bleach, use bleach. And we don't require you to use natural products in place of bleach. If you go back, you'll get a chance to go back and read that when we send out the slides at some point. What we do say is that bleach is, look for EPA registered bleach and use it according to directions. We absolutely recognize there are, you are not, whatever state you're in, you're not the only state where they require bleach. So that's not at all prohibited by what we're putting out as a best practice recommendation for disinfecting and sanitizing.
And the thing I would add to that is when we're talking about using biodegradable natural products, we're talking about using third certified parties cleaners. So just paying attention to when you can clean in a facility versus when you have to sanitize and disinfect. And if it's something that you can just clean, then you want to be opting for things that are not bleach for disinfectants or sanitizer. You can be choosing a third-party certified cleaner, and that's the Eco Logo Green Seal or EPA's Design for Environment program.
Great.
That's a really good. Thank you.
Yes, and I think that we're out of time. So I do see a few other questions, really great questions here. So we will definitely provide responses and send around to everyone via email. Please remember to take the survey that will be emailed to you. And I hope everyone found this to be a very informative webinar on, all of the wonderful work and progress being made in the non-regulatory settings and how this information can feed hopeful progress on the regulation and licensing side to better protect children's health in early care and learning environments. So thank you all for joining us. Thank you to our great presenters, and I hope everyone has a great afternoon.